Thank you very much, Dr. Koop, and I think all of us who have followed this issue in the Congress, outside as well, have to commend you for the leadership that you've been providing and the courage in which you've brought this to the attention of the American people. I just think that your presentations have been very clear. I'd like to just, if we could, review a couple of the significant facts. Because I understand unless we find a cure for the disease, between 20 and 50% of those infected will eventually develop the full-blown disease. Is that correct?
That is correct. Because of the long incubation period, sir, it's absolutely impossible for anyone to tell you how many of those who have the virus and are now asymptomatic will come down with the classic AIDS syndrome or something less important. But your figures are correct, but they could be higher.
And the disease so far has so far proven 100% fatal. Is that correct?
That's correct, sir.
And it's true, isn't it, that unless we mount an aggressive campaign to control the spread of disease, the number of infected Americans could climb as high as 5 million by 1991.
I think that's correct because we have neither a drug for cure nor a vaccine for prevention.
It seems that our best efforts are, one, the development of the vaccine, and the second, the whole question of education. You've identified these goals in your report. Now, your recommendations will not be implemented. They'll require the support from all levels of government and the private sector. What do you think should be the role of the federal government in terms of the information campaign?
Well, I think it is the obligation of the federal government, particularly the Public Health Service, to make available to the states, to the people, to the private sector, all of the information that we know scientifically, and they demonstrate to them our willingness to work with them in any way that we can, perhaps even set up cooperative demonstration projects. But inasmuch as education and information are the only weapons we have against AIDS, it will require extreme cooperation. And we have to be innovative in the manner in which we do this, because we are dealing with some people who are victims of this disease and are possible victims in the future who are not literate enough to follow a report such as we have written. And we have to reach those people as well.
Well, do you think the federal government role is adequate given the nature of the crisis today?
I think it is, sir, and I think that we are gathering momentum. We're getting up more steam. We're working as hard as we can. We'll be coming out with as much information as I think the public and the state and local health office can absorb, and we will be standing behind them to help in any way that we can.
Let me ask you, as a result of your own study and the material, the information that you've had available, based upon scientific information, should the American people be concerned about catching the disease from casual contact?
No, sir. AIDS is
I'm talking about, because we have people watching this, I think it's, and for the record, it's important. We're talking about in the workplace, talking about food service workers, or even from infected children in schools. I'd like to hear your answer, and I want you to tell us what is the basis of your scientific information that leads you to that conclusion.
Well, all of the studies that have been done in the private sector, in government, the surveillance by the Centers for Disease Control, would indicate that AIDS is not passed by non-sexual casual contact. You don't get it by sharing towels, by sleeping in the same bed, by using the same telephone, not even by using the same toothbrushes. You don't get it from pets. You don't catch it from insects such as mosquitoes. And I think that we have demonstrated as well as one can scientifically that these are factual statements, sir.
Your report advocates that voluntary testing for infection be kept strictly confidential. This contrasts with the practice with regards to other venereal diseases where the Public Health Department often traces contacts to decrease the risk of contagion. Why do you feel this practice is inappropriate with AIDS?
Well, because the stigma that has been associated with AIDS is real. many afflicted with the disease or who are infected with the virus are reluctant to be identified with AIDS. And because there is no vaccine and no cure, many feel there's nothing to be gained by revealing their sexual contacts that might also be infected with the virus. And when a community or state requires reporting of those infected with the AIDS virus to public health authorities in order to trace those sexual or intravenous drug contacts, as is the practice, as you've mentioned, with other sexually transmitted diseases, those that are infected with the AIDS virus tend to go underground and out of the mainstream of healthcare and education. And for this reason, public health practice now in this country is to protect the privacy of the individual infected with AIDS and to maintain the strictest confidentiality concerning his or her health records.
You, in your report, you state that quarantine has no role in the management of AIDS. Can you explain why this is the case? Are there any situations where quarantine is appropriate?
First of all, to identify those people who should be quarantined would be a prodigious, probably impossible task and maybe even cost prohibitive. You'd be dealing, if you could find them all, with, as you've already stated, sir, millions of people. And inasmuch as I have stated that casual, non-sexual contact is not a source of contagion, it doesn't seem that that kind of quarantine would be worthwhile.
Mr. Windham, we're glad to have you here. We have the recommendation. Do you, first of all, do you agree with the IOM recommendations on the appropriate level of national AIDS research and public health commitment?
The IOM's report certainly was very well received, and we agree with their goals. We hope that they can be achieved. I think that the progress we're making now is certainly going toward that goal, and I think from year to year we'll see it increasing.
We have been through the past few days. I've heard the Secretary of Defense and the Secretary of Education. One responds, you can't solve problems throwing money at it. The other one seems to, the Secretary of Defense believes that probably you can. Let's put that aside as a debater's point and look at the real allocations of priorities in these areas, and given the kinds of indications which give some sense of hope of progress. We don't want to overestimate it, and we want to be frank and candid and accurate about those. But just in terms of the dollar figures, in the areas of research, you're going up to approximately a $91 million increase up to $413 million, which is not even half of what the recommended figures were in terms of coming to grips in a serious way with this particular challenge, which is going to be the first really scourge in the United States in terms of a disease, with at least the projections and predictions now of 100% fatalities. Given that problem, and given the reduction that, or given the very marginal amount that you have in terms of education, 112 million, proposes 112 million, again $1 billion in terms of what has been recommended by those that have given this as figures which could be appropriately, usefully, effectively spent in this areas of terms of education. And we stress education now, given the certain lag that we have until we can make the kind of meaningful progress in areas of the challenge in these next several years. How do you justify that? Are you going to oppose the efforts that I and others are going to make to try and make sure that you get adequate funding in terms of both the education and the medical research program in the budget?
Senator, the issue of AIDS is our priority in the Public Health Service and the Department of Health and Human Services, and education is our major and only effort to really come forth to a means by which we can prevent that disease today. And as the IOM report indicates, it's a projection to 1991 of the dollar value. It's also the fact they agree that we need support and effort from every part of our country. We need the media, which has done an excellent job to date with hour-long or longer television programs, cooperation in the education efforts throughout our society. And we feel that we will be able, through the Public Health Service, as a resource of the knowledge and the best information known today, which will be changing as we go forth, because 5.5 years ago, this disease was not known. I think the progress is very rapid in that short time, and we are stressing and using the funds very adequately, along with the support and cooperation of so many other segments of our society and government.
Well, I'm not sure that completely responds to the question, but
Well, in the area of education, or excuse me, in research, we have top priority for AIDS research throughout the Public Health Service, and we have no plans whatsoever to decrease that emphasis. And as Senator Weicker indicated earlier, the basic biomedical structure that we have in our federal programs and throughout the nation have made it possible for us to advance so rapidly. And so besides just targeted money for AIDS, there'll be many areas of research going on that will have benefits that will spin off to the disease like it has in many other diseases.
just final 2 points. One is, I think you can demonstrate quite clearly from an examination of the NIH budget, you're really robbing Peter to pay Paul. That you're taking important resources from research in the areas of cancer and a wide variety of other kind of diseases where there's a high degree of approval of various research programs under the peer review system that ought to be funded and that can really make a very significant and major impact in terms of the quality of health for the American people, and siphoning those resources off in terms of the aid program. I'll give you an opportunity to respond, or you can respond in greater detail. But I think any fair examination of that budget would have to draw that conclusion, and that's wrong. That's wrong, and I want you to be very clear that we're going to do everything we possibly can to redress that kind of a situation. I give you an opportunity to comment if you want on it.
Senator, each year there has been a continual increase in the awards and funding of the National Institutes of Health, and also we are giving this next year will be the highest number of research award grants ever in the history. So we do not feel that we are sacrificing other research, but we're trying to bring some stability to that funding level.
Well, it's, as you know, it's $649 million, recommending cuts in the NIH of $649 million over this year and next year. So, and the Senator Weicker makes these points very well as a member of the Appropriations Committee, that it's basically the increases are coming as a result of the actions here in the House and Senate. Don't want to divert the thrust of these hearings in it, other than to make sure that we put in some perspective as we begin these hearings, other committees do, about where we are in terms of both the research and the education program. Dr. Koop, I just say finally, and then I yield to Senator Weicker, one of the programs that we see not so frequently, but sometimes with children are on those Saturday mornings, you see those whole series of cartoons. There never seems to be any intervention in terms of whether it's AIDS or other kinds of public health kinds of questions. If we're trying to reach those children, it might just take, I'm sure you're familiar, those cartoons run from God only knows what time, early in the morning till noontime. And it's an ongoing, continuing process, and you might just get a look at it and see what opportunity there might be for intervention in those areas. Having gone through the holiday season with some little grandnieces and nephews and hearing those television programs early in the morning and knowing their rapt attention, there may be an opportunity at early intervention.